Hello, everybody. My name is Aakriti. I'm currently a sixth-year doctoral student in the clinical counseling psychology program here at NYU. Today, I'll be presenting about acceptance and commitment therapy. I was able to use the Professional Development Award to learn more about ACT, and I'm very excited to present it today. The title of today's presentation is Making Space and Moving Forward, an overview of acceptance and commitment therapy. So just to provide a little bit of an overview and a brief history of ACT. So ACT was formed in the 1980s by Dr. Stephen Hayes after his dissatisfaction with symptom reduction only models. He was finding that there were a lot of treatments where maybe patients' immediate symptoms were able to be reduced, but at the same time, they were having a hard time engaging meaningfully with their lives, really making the most of it. And ACT was a counter to some of these treatments that focus only on symptom reduction and changing thoughts. In the 1990s, there were manuals written, initial research was conducted on ACT. In the 2000s, there was growing evidence, and ACT began to be accepted as a third wave form of CBT with a growing evidence base. And then from the 2010s up until now, there's expansions, there's more research, ACT being applied across different settings, and just continued growth with this type of therapy. I'm going to get more into the different waves of CBT, as I mentioned, that ACT is a third wave CBT and kind of what that means, and how ACT became the therapy that it is today. So the first wave of the behavioral therapies is this idea of behavioral therapy at its core. So the key idea of behavioral therapy is that behaviors, which is often shaped by our environment and by reinforcements, are the problem. So they are what causes people distress. Maladaptive behaviors are what cause people distress. And the way that we make people feel better is that we change their behavior. We replace harmful or maladaptive behaviors with constructive or more helpful behaviors. And this is based on principles of operant learning or reinforcements and conditioning, what one is trained to respond to. So I'm going to bring in an example that I'm sure a lot of graduate students can relate to, which is this idea of procrastinating on assignments. Maybe even very important assignments that they should not be procrastinating on. If someone came in with a struggle of with a behavior therapist, they might say the main problem is that you're procrastinating on your assignments. So we need to make up a system where you're not procrastinating on your assignments. Maybe there's a system where you create rewards for yourself for completing XYZ number of tasks on time. Maybe there's punishments if you're not able to do so. In a way, grades also and deadlines also act as that function of if you're able to set these deadlines, then you're able to maybe get these papers done in time. And the reward could be a good grade, the punishment could be a bad grade, but maybe there are other things that you can do as well so that you can set up these systems for yourself and of rewards and punishments. The reason why there's a dog here is based off of Pavlov's very famous experiment where every time he rang a bell, he would give a dog a treat to the point where like even just being with the bell made the dog want to start salivating and want the treat. Maybe there's a similar thing that someone could do. Every time they sit down at a specific desk in their home, they start working. So over time, even just the action of sitting down at that desk makes them start working and procrastinate less on their assignments. And then they get a reward for finishing the assignment on time. The second wave of the behavioral therapies is this idea of cognitive behavioral therapy. So while behavioral therapy is focusing only solely on the behavior, cognitive behavioral therapy is saying it's about more than that. It's about our thoughts. And essentially, our thoughts influence how we feel and behave, and unhelpful and distorted thoughts, often that take place automatically without even realizing them, they're the problem. So how do you make people feel better? You help them slow down, you help them notice, you help them question, and you help them change those unhelpful thoughts. And this is based on the idea that if you change your thoughts, you can feel better and you can act differently. Going back to this example of this graduate student procrastinating on an assignment, maybe the behavior that they're doing is that they're procrastinating on the assignment. We know as in psychology that a lot of times procrastination comes from anxiety. So there's something that's making this person feel anxious. Maybe they feel like they won't do a good enough job. Maybe they feel like the task is too hard. Maybe this taps into some of their core beliefs and how they see themselves of I'll never be good enough. I'm bad at this. This is too hard for me. I'm an imposter. Just a lot of things that is affecting their core belief, which affects how they see themselves, how they see other people, how they see the future. This is making them feel really anxious. this is making them want to avoid the assignment so they don't have to think about it, and they can just sort of put it off and not have to deal with that anxiety. A cognitive behavioral therapist might really work with someone to identify what some of those thoughts are, of someone saying like, I'm an imposter, I'm not good enough, I shouldn't be here, and challenging that and saying, well, what makes you believe that? What are reasons that you might be feeling that way? What's evidence against that? And how can you change the way that you're feeling about this? Which then would change the way that you feel about this, which would then change your behaviors. If you're able to help someone change their thoughts, you can feel better, they can act differently. The third wave therapies, which are the mindfulness and acceptance-based therapies, is arguing that the problem isn't necessarily having these difficult thoughts, but it's getting stuck fighting them that ends up being the problem. So how do you make people feel better? You help them accept their inner experiences, you help them be present, and you help them take actions based on values and not on fear. There's a lot of different types of therapies that fall into this umbrella, which includes dialectical behavioral therapy, compassion-focused therapy, mindfulness-based cognitive therapy, and the topic of today, acceptance and behavioral therapy, acceptance and commitment therapy, that fall into this larger umbrella of the third wave therapies. And I love this comic on the side of, if you think of your fears as monsters, the idea isn't necessarily to get rid of the fears, isn't even to fight the fears, but it's learning how to live with them, how to make peace with them, and live your life sort of around them. Getting into the main topic of today's presentation, acceptance and commitment therapy. There's 6 different facets of acceptance and commitment therapy that create the hexagon or hexaplex, that all contribute to this idea of psychological flexibility, which is someone's ability to accept, understand, and manage their thoughts, feelings, and behaviors in a way that promotes well-being and allows for adaptive action. And I will get into what all of these different things mean and how they contribute to ACT. ACT is typically a short-term therapy, but it can also be seen as just encouraging patients to have a different way of relating to their thoughts and feelings. So the first component of ACT is attention to the present moment. And the main skill that folks are trying to learn is how to be here in the now. In this image on the side, someone's walking through the park. Their mind could be on 1,010 different things of, there's all these things that I have to do and car payments I have to make and music that I'm listening to and worries that I've had in the past. And their mind is in 1,000 different places. Or they could be really shifting into being present in the here and now, smelling the roses, smelling the trees, feeling the sun on their skin, and really just being present in this moment. So one of the main skills that is taught with this facet of ACT is attention to the present moment and being here in the now, and really noticing things like breath, how they're breathing, what their surroundings are like, their emotions are like in the moment, how are they feeling as they're walking through this park, and body sensations as well. And this is built over time through meditation, through practice, and intentionally taking the time to slow down and really being present in the current moment. The second is acceptance. The main skill here is allowing someone to feel their feelings and just allowing the feelings instead of trying to fight them. And to the title of this presentation, really making space for that feeling and allowing the feeling to just exist and noticing and naming the feeling. On the visual on the right, let's say that it's raining. There's 2 different ways that someone can react to the fact that it's raining. They could say, oh my God, it's raining. I really didn't want it to rain today. I don't like the rain today. It's really tough. I really hate it. Like, this is terrible. This is ruining my day, and go on and on and on. Or maybe an acceptance approach to this would be to say, it's raining. Yeah. Okay. I'm going to put on my boots, and I don't have to be happy about it, but I'm going to go, put on my boots and acknowledge the fact that maybe I'm not that happy about the fact that it's raining. Cool, but I'm accepting it. Another key aspect of ACT is the idea of diffusion. And the main skill here is creating distance from the thoughts and observing thoughts without judgment. So earlier in the example of the graduate student, maybe they feel like they're stupid, they shouldn't be in the school, anything they're feeling like that. A way of diffusing from that thought is even saying, instead of saying I'm stupid, stepping back and saying, okay, I'm having the thought that I'm feeling stupid. I'm noticing that I'm having the thought that I'm feeling stupid, and distancing themselves from it, kind of viewing their thoughts as clouds in the sky as they're laying back in this park or wherever they may be. And their thoughts are just sort of passing by their brain instead of being in the thought and saying, I am stupid, stepping back and noticing the thought and creating a little bit of distance or diffusion from it. Another skill of ACT is this idea of self as context. And the main skill here is realizing that someone is not their thoughts and feelings, but merely the vessel for their thoughts and feelings. So this example again of someone saying, I'm stupid versus I'm noticing that I'm feeling stupid, distancing themselves, they're not that thought and feeling. And also realizing that if we're thinking about thoughts as clouds in a sky, one person is not one individual cloud, but rather they are the sky during which these thoughts pass back and forth between. And they're not one individual thoughts, but merely a vessel for just the hundreds and thousands of thoughts that cross through someone's brain and mind every single day. Some are positive, some are negative, but they're all just sort of there in the sky. Sometimes it'll be rainier, sometimes the clouds will be lighter, but you are the sky and not any specific clouds within the sky, which is the main skill of this aspect of self as context. And then the last or another facet of ACT is values. And the main skill here is figuring out what is important to you. And if your life was a compass, what would guide you? So essentially, there's a lot of different values that people can have. Some people might really value generosity. Some might value excellence, simplicity, leadership, creativity, wisdom, community. The list could go on and on. And to this example of this grad student who was procrastinating, one way to tap into this idea of values is tapping into, well, why is it important for you to come get back into grad school and get this degree and go forth with that? You could do so many other things with your life. Why are you in grad school? Why is this important to you? And leaning into that of, well, these assignments that you're procrastinating, they're related to this goal that you have that is based on this value that you have. And we can think about it that way of, even if this is hard and we're having these thoughts that things are really hard and we're feeling really stupid and we're noticing that we're feeling really stupid, this is still really important to continue with. This is still really important to move forward with because you really want to apply your knowledge, you really want to learn. This is a dream that you had for a long time, and this is something that matters to you and is important to you. Similarly, with folks who have feelings of depression, a lot of values is recognizing what is it that's really important to you and how can we push you towards doing that even when things are hard. Which brings me to the another tenet of acceptance and commitment therapy, which is taking action, which basically goes into what I just shared of recognizing someone's values and taking steps towards those values, even when it's hard and even when it sucks and even when it's raining and even when it feels really uncomfortable, and do what matters even when it's hard. One way of thinking about ACT has a lot of metaphors, but one is this idea of passengers on the bus. So this idea is that someone is driving their own bus, they're going merrily along their way, and there are a lot of passengers who come on and off the bus. Some are very calm, some are very positive, and others are negative and yelling and saying things that you don't want to hear. And the goal of the bus driver is to get to where they need to go and be able to deal with many different passengers on the bus. Similarly, ACT and ACT therapies operate under a similar premise of you're moving towards your goals, you're moving towards what matters. Sometimes there will be thoughts and feelings that are like these annoying passengers on the bus. And how can we deal with them and keep it moving, make peace with it instead of the bus driver turning around and trying to fight all these individual thoughts and feelings that are negative? He wouldn't get anywhere. So moving forward, even with annoying passengers on a bus. There's been a lot of research done on ACT that shows that it's effective across many different conditions for anxiety, for depression, chronic pain, OCD, substance use, and medical illnesses. It can be comparable to traditional CBT in terms of sustained gains and how people benefit from it. And it improves psychological flexibility, which helps people be able to live with the many different things that life throws at them, which improves functioning and well-being. Rather than just focusing on reducing their symptoms, it's a way of allowing them to engage more meaningfully with their lives at large. One really important thing to note about ACT is that there is a lot of overlap between key principles of ACT and Eastern philosophies and religion, including Buddhism, Hinduism, and Taoism, and a lot of influences from these faiths. And that both have this shared focus on mindful awareness, all emphasize observing the current thoughts and feelings with openness and non-judgment. ACT's present moment attention, Buddhist mindfulness, Hindu meditative practices all have this core theme in mind. All sort of have this idea of acceptance and non-attachment. So ACT's acceptance and diffusion is kind of similar to Buddhist values of acceptance of suffering, and Hindu values of letting go, reducing clinging to thoughts, emotions, and outcomes, and this idea of values and purposeful action as well, of Hindu concepts of dharma, Buddhist ethical intentions, and really thinking about acting according to purpose rather than avoidance or control. This is really important to note because there's a lot of different communities around the world who have been doing things for a very long period of time. A lot of these religions are ancient, that are very similar to some of these psychological therapies and styles that in the Western world are maybe more recently created. And it's important to note that there's a lot of things in psychology that have a lot of influences from other places, and even just the same principles, if we're applying them one way in a psychological, psychotherapeutic framework, maybe there's another way that somebody else is doing something similar, and maybe that's not being seen as efficacious or anything like that, when there actually has been a lot of things that psychology can learn from faiths and communities around the world, and vice versa, that this process of learning should be going both ways, and acknowledging like where some of these influences for therapies like ACT may be coming from. There's a lot of books on ACT, Get Out of Your Mind and Into Your Life, which is one, and a lot of ways of adapting ACT to couples, to teenagers, for different conditions. It was a joy to learn more about it. It's definitely a therapy style that I resonate a lot with and use with a lot of my patients, whether they're in the hospital and community mental health, with kids, with adults, with youth. There's a lot of value in just being able to separate from your thoughts, and live a life that matters to you, make space for those emotions, and move forward. And yeah, I hope that this is something that anyone who wants to learn more about can definitely pick up any of these great books and learn more about acceptance and commitment therapy. Thank you so much for the time to present today. Yeah, thank you.